started, I just want to also quickly remind everybody about CMEs, CNEs, and all other continuing education. Don't forget to sign in, don't forget to check in, and really quick, your codes, your QR codes change every day, so make sure you pick up a new QR code thing every day. We just discovered that this morning. So it's my pleasure to introduce our moderator, Terrie Price, who is who sits on the TCHMB as our AWHONN representative. And Dr. Price is the Texas section leader for the Association of Women's Health, Obstetrics and Neonatal Nursing, AWHONN, and director of antepartum and labor delivery and obstetric emergency department and gynecology, all of that stuff at St. Luke's. Sorry. She has over 30 years of experience in women's health as staff, a charge nurse, education manager, and director. Dr. Price earned her Bachelor's of Science in Nursing from the University of Texas Health Science Center in San Antonio, a Master's of Science in Nursing and Leadership and Management from Western Governors University, and her doctorate in nursing practice from Touro University in Nevada. She's the ACOG Maternal Level of Care Surveyor and a member of the Sigma Alpha at-large chapter. Sorry, Sigma Delta Alpha. I don't want to mess that one up because that's an incredibly important organization. So, Dr. Price.
Thank you all so much. I am very honored and privileged to have been selected to introduce our speaker today. So I want to tell you a little bit about Dr. Sanjie Garza-Cox before we get started. So I'm going to have to read because she has like a host of great backgrounds. So Dr. Sanjie Cox is a graduate of University of Texas at San Antonio. She obtained her medical degree at the University of Health Science Center in San Antonio. She completed her residency and neonatal perinatal fellowship at the University of Texas Medical Branch in Galveston. Dr. Garza-Cox has over 15 years of experience in neonatal. Neonatology, with a special interest in simulation, child death review and prevention, breastfeeding, women's health, physician, clinician, burnout prevention, which is very important. She works for Pediatric Medical Group and is an active neonatologist at Methodist Children's Hospital. She serves on multiple boards, including Bexar County and State of Texas Fatality Review Board and the Fetal Infant Mortality Review Board. She's also the founder and president of Baby Education for South Texas, which is known as BEST. BEST is a nonprofit organization which focuses on family education and accidental death prevention. So if y'all can give us a round of applause for Dr. Sanjie.
Thank you so much. It's so nice to see you. Thank you so much for having me. Yes, what I was supposed to do?
Oh, I'm sorry.
I was supposed to do something. There we go.
We'll switch to yours.
Perfect.
And then what you say from the beginning. And then the arrows in the mouse.
Fabulous. Fabulous. So once again, welcome. It's been a long time since I've been in a room like this, so I'm feeling a little anxious. It's like we were talking, it reminds us of medical school, right? So we'll see how it goes, but at least you're here. Hopefully you can see the slides. So the only disclosures is that I am the founder of BEST, which focuses on community education and strategies to improve the health of the infants that we serve. And other than that, I have no financial or conflicts of interest. So what we're going to talk about today, hopefully we'll get it done during this time. I do talk pretty fast, but I want to make sure that you have the opportunity to ask questions and to begin a conversation. I'm going to spend the first so many minutes, about 7 minutes, talking about what SIDS is and what is SUID. There's a lot of confusion about those two terms, and why we focus on accidental suffocation and strangulation in bed. We're also going to talk about how SUID includes the interaction between a baby who is vulnerable to having death happen to them, and how it relates to the asphyxiating and overheating environment. We'll also talk about the stress of the importance of safe sleep practices and reducing this risk of preventable death. And then we'll spend about 10 minutes talking about what we've been able to accomplish in Bexar County and what we're working on doing in our particular RAC. A little bit of background. So sudden unexpected infant death is not a new term, but it hasn't been around forever. Basically, it's an infant that dies within the first 365 days of life and is suddenly and completely unexpected. It is classified as explained and unexplained, and the only way to make that determination between one or the other is by doing an autopsy and a complete examination of the death scene. This is probably the part that the MEs hate the most, the fact that they actually have to go to the home and talk to the family and have reenactment of what happened. How was the patient put to sleep, where did they sleep, and how did they find them, and what happened afterwards. It is quite dreadful. We do deal with an ME, the youngest one in Bexar County, and he has to do a lot of these, and they're terrible, but it's something that needs to be done. Everybody in the family and anybody who was around at the time of death, it gets interviewed by the ME, along with, it depends on who gets called to the home, right? If it's EMS or the police department, they do the interview and they document a lot of that as well. Simply because, as you know, the stories change depending on who you're talking to or what time you talk to them. And then the review of the clinical and medical history, which sometimes is a little challenging, as I'm sure it is in most of your counties. Our patients shop hospitals. So it's a little bit hard to get that clinical and medical information that is actually succinct because you have to go to several places to find it. So the breakdown is in front of you. It's sudden unexpected infant death, explain and unexplained. Explain is pretty clear, right? Whether it's trauma or drowning or ingestion, a known medical condition, or the accidental suffocation and strangulation in bed. Unexplained is what we typically know as SIDS, right? SIDS, it only happens when we can't find another reason. The child is not vulnerable to die, and there is no medical condition, there's nothing else, that we're in the perfect, safe sleep environment, as far as we know. And so there's no explanation. It's a healthy child that died. And then there's always the undetermined. We're going to focus on accidental suffocation and strangulation in bed. And when I talk to you as specifics, I'm going to give you the caveats about the numbers that we have and why they're caveats. But there is always the possibility, as we review cases, that we have a child that clearly was sleeping in an unsafe sleeping environment, but they had also viral pneumonia. So the ME has to write undetermined as the cause of death, because it could have been the viral pneumonia, but the fact that the baby was under the parent's arm probably was the reason for that child's death. So accidental suffocation and strangulation in bed. This is kind of, because I like to move my head and it's just weird. Asphyxia is a situation, as you all know, that your oxygen comes down, your CO2 rises, right? It can happen when you have apnea or simply difficulty with breathing. It happens anytime that your airway is obstructed by something that you are choking in or something that is around your face, or when you're rebreathing air, right? Your CO2 continues to climb. And asphyxia has always been part of SIDS. We know that. And we'll talk about the Back to Sleep campaign and why that came about. But some asphyxiating environments will kill any infant, right? If you sleep on top of the baby is probably gonna die. But in most situations that are asphyxiating, most infants will not die. And that was true because I'm pretty sure a lot of us slept on our abdomen when we were little. So we didn't die, we're here. So the asphyxia challenge response, I know it's a little hard to see because there are two big charts, but basically what we're saying is that in a vulnerable infant, because you may have some brain spur pathology, you are more likely to die on a very slight asphyxiating environment. But if you have normal brainstem and you're a normal healthy child, it takes either repeated events of asphyxia or hypoxia or a major event that causes your death. Most infants, as you well know, have the reflex, the chemoreflex, where the CO2 rises everything is better. And most infants have the ability to push themselves or turn their head if they roll over or somebody is on them. But there is that specific age where we see the highest number of deaths between 2 and 6 months of age, where they don't have the strength and the ability to cry or move you or push you or roll their head. So we know rebreathing, airway obstruction, particularly with blankets, or a parent or a sibling, and it's the problem that sometimes happens and the children end up dying. So I'm gonna go over some of the things that these slides were shared by. Some of them are reenactment scenes, some of them are from the ME office, and some of them are just simply from online, about what we typically hear when we do talk about how was your child put to bed, how was the child found. And so one thing that happens often is we do talk to the parents, right, and tell them they need their own self-contained sleeping environment. But sometimes that's where the conversation ends. And if you can see on the first one, you can see my pointer, right? Nope. Well, the first one, the top left, he is in his own safe contained environment. He's not sleeping with anybody, but we have all that fluffy stuff around the baby. And then you see the babies that sleep with the parents with the big fluffy blankets, or they sleep in their own place, like the bottom picture, with a pillow and a blanket and teddy bears and everything else. So we see a lot of infants dying that way. Wedging of entrapment. For some reason in our community, we seem to typically have a very small living environment, which means one bed, which means mom, dad, the 10-year-old, the 6-year-old, the 2-year-old, and the baby sleep on the bed. We've had many infants who are put to sleep at the foot of the bed where the 10-year-old and the 6-year-old can't get the baby off, but they feel he's safe because he's not in the bed. He's in the bed, but he's at the foot of the bed, away from the rest of the people. Well, or we put them right next to the wall because that way the baby doesn't roll off the bed. And so that's when we see the entrapment and the wedging that happens and the baby gets asphyxiated. Strangulation. Sometimes we're lucky to have a crib, but unfortunately we don't ask how old the crib is, how many times have been used, has it been maintained, is it a current crib? And a lot of the times the cribs are being used, but they're not being maintained. And so you end up having a child who strangulates themselves. We had a case that happened about 2 years ago of a young girl, an infant girl. She was about 4 months old. She was beginning to kind of move around a little bit, but the crib was right next to the blind cord. And so she ended up strangling herself. So it's terrible, and it happens. But once again, we don't necessarily talk to the families about this because, I mean, who would do that, right? But we have to actually ask, what is exactly are we talking about? Crib, bassinet, what's in it, what's not. In our community, I would say about 50% of the infants that die do have a crib or a bassinet, but is used for storage. So we have to ask those questions. Overlay with bed sharing is a big one. As you can see on the left-hand side, I don't know if you can appreciate, but the mom has tears running down her face. That's the reenactment that she was asked to do. So we do sometimes don't have a bed, or we fall asleep breastfeeding. And so we have to be very, very careful, and we have to educate parents about what to do in those circumstances, how to prevent that from happening. And the only way that we can do that is by making it personal and asking a lot of questions. The other image is a police officer who is trying to reenact how the father said he was sleeping next to the baby. So basically, sudden unexpected infant death in summary is an infant who is vulnerable, who cannot mount a protected response to asphyxia or an event. We also have known that overheating can cause these asphyxiating events. But any infant is at risk when placed in a highly asphyxiating environment. It can happen to any child. The cause of death typically is multifactorial, so when the cases are reviewed, we have to determine which one is the most likely cause. And for the ME, like I said, if there's a compounding factor like an ear infection or viral pneumonia or a cold, they have a tendency to call it undetermined. And then, by eliminating unsafe sleep environments, we do know that we can prevent these deaths. They're all preventable. If it's a normal child, they're preventable. So what are up against? We want to know what we're up against. Well, this slide was, it's actually a few years old. I think it's 2016. But what's really interesting about this slide is that 78% of women have heard of SIDS and are afraid of it. But yet 28% share, what is it? I can't see from my thing, sorry. Have put the baby on their stomach, so they know how to prevent SIDS. But they put the baby in the stomach, and sometimes, and 65% of them put something else in the bed with the baby. What's even more scary is that 98% of moms that have a baby that is an infant know that they should sleep alone and on the back and in a crib, but only 60% of them agree with that recommendation. So that's pretty scary. A lot of the times, particularly grandmas will come and tell you, I don't understand what you're saying. I mean, we all slept in our bed, on our belly, and we did all well. So once again, we have to explain why extenuating circumstances can actually cause a baby's death and why it's personal. Also, remember, one thing that you need to bring back sometimes is to talk to them about the inability to communicate via social media, news, anything that you right now have in your hands. That was not there when I was a child. So my mom did not hear about the other things that were going on in the city, right? And sometimes if you bring it to that level, it's because you never heard of it. Well, remember how you used to get your news? And then maybe it kind of clicks in their mind that, oh, maybe that's why I never heard of it. So the big one, I don't know how many times somebody has told you, well, if I put her on her back, I mean, she eats the spit up, she has reflux, she's going to die because she's going to choke. This image is something good to carry or have in your office or with you to show them where the esophagus and where the trachea lie, right? If you're on your back and you have some emesis, you're more likely to just spit it out. If you're on your belly, it's likely to go right into the trachea, causing aspiration. The other one, well, his head is going to get flat. If we always put him on his back, his head is going to be flat. Well, let's talk about tummy time. Let's talk about activities with the baby. Let's talk about quality time spending with the baby. That's a great opportunity to talk about staying away from the TV and your phone and actually pay attention to your child and why it's important and how it helps on development. Now, Walmart, Babies R Us, who's no longer existent, and Target, and everywhere you go, the products that are available are pretty darn scary. It's heartbreaking when in the NICU I'm talking to a nurse and she tells me that she's using that thing right there, the Donkaton, I think it's called. We have to talk, take an opportunity. It's not my patient, hopefully never will be, but I'm going to take an opportunity to talk to you how it should be used and how it shouldn't be used. A lot of these products actually have gone off the market, and Graco was one of the first ones to step on the board in saying, I'm taking all my products that are unsafe sleep environment off the market. We're hoping others follow as well. But they're marketed as safe. Crib bumpers, you only see them in some of the couture stores now because they try not to sell them. Now, unfortunately, our friends in the movie industry and then the TV industry and all the celebrities that we follow, some of them you may recognize in those pictures, don't help our cause simply because they show the pictures of them sleeping with their own children. So, and we're going to trust them more than the person in the clinic. So the data. Let's talk a little bit about how this all came to be. The AAP released the safe sleep recommendations where it was said, you know, you need to educate the families, they need to be on their back, they need to, you know, be safer. We're losing too many children. And then the Back to Sleep campaign came in from the CDC and the NIH, and everybody got on board with all the media and, well, media. It was back in 1994, I think, Yeah, so media, as you could have been there. Then the investigation reported form came into being. That was a game changer, and the reason why it's a game changer is because you can see in that graph the sudden infant death syndrome, which is the unknown cause, started coming down, but you can see that the accidental suffocation and strangulation base started going up, right? Because in that form, we have to actually ask questions and do the autopsy and figure out exactly what is it that killed the child. And then Safe to Sleep came into being, which expanded on the back to sleep. Not only does the baby have to be on their back, but they have to be surrounded by nothing. And that's when the campaign, and that's when we start seeing even more the differentiation between strangulation and suffocation in bed as opposed to SIDS. So what were we seeing in Bexar County? Well, in Bexar County, the Child Fatality Review Team, which most of the major counties have and is active, very active, started seeing a rise in our preventable infant deaths. Now, with this chart, be a little mindful that the way that the deaths are reported, it's still to this day for the United States and for Texas, according to the CDC Wonder website, they are all combined in one. There is a way to separate accidental strangulation in bed, but those numbers are very small because most people enter the first thing that is on your death certificate into the website, and that is what you get. So you can see if we add all the SIDS together, or the SUIDs, and then you compare to Bexar County, we were doing pitiful. There's something that was going on in our community that we needed to address, and we needed to create that first step, which is we have a problem, we need to raise our voices, we need to do something about it. So that's when we raised the alarm. And a group of neonatologists and ME got together with our health department and created a letter that was sent to all the providers within the community talking about where we are and seeing increase in infant deaths due to something that is preventable. We started working with the hospitals about standardization of the educational materials to make sure that we're teaching the same thing. But most importantly, if you work in a hospital, modeling is key, right? You can't have a baby sleeping incorrectly and then expect the mother, no matter how much you tell her, to do it right when they go home. Standardization of EMR documentation is very important to prove change that we actually have done the education. So that had to be modeled. And most importantly, we had to get the community in place. We had to get more than the medical team and the health team. We needed the whole community behind us. And so as we were trying to do all of this and release the information, our data actually got worse. You can see a nice increase on that data. And those are all infants that were who died not from SIDS, but from preventable causes, because we teased them out during our meetings. So some people started saying, well, it's probably only in certain parts of town. It only affects a certain amount of people. Do we really all need to get together and make this a change? Well, what we did in just a year and a half, we mapped every single death that happened in our county. And as you can see, it's everywhere. It's not one place, it's in the entire county. So that was like, oh, okay, well, maybe we do need to do something about this. But then we figure out, or 6 neonatologists and 1 ME, that we couldn't do anything without having money. That's the way it works. And so we had to create a nonprofit through which we can funnel all the energy, some of the money, so that we can help affect change in our community and make an impact and have a name for ourselves. So that's how BEST came into place. But the most important thing about BEST, just like any other community action team, is that it had to be formed mostly by community members. Not so much healthcare members, but community members that were part of nonprofits, the health department, and everybody else who had skin in the game to make a change. And that's what powered this change so much. One of the first things that we did is play on that. We have 6 hospital systems in our community. So they're very competitive. Nobody wants to be behind. So we used that as an opportunity to incite the first one, which was the easiest one, and it's not even a civilian hospital, it's a military hospital, and becoming hospital safe sleep certified. Well, once they did, which didn't take them very long, because evidently sometimes things happen quickly in the military, they got the gold. they got the highest level, and we're going to talk about what the different levels are in a little bit, but that incited some of the other hospitals to say, oh, they got on the news. Everybody knows about that. We need to do the same. And us as neonatologists and the nursing staff that we had that sits in those hospitals were able to push for the competition to occur. In addition to that, we took on some other, remember I said it's a community, not just a healthcare-based problem. And so we were able, through that funneling of money, to fund what is called direct on-scene education, where there is a trainer who comes and trains the trainers into our EMS and fire department so that they can learn to recognize when they go into the homes, if there's a child, first thing they gotta ask is, where's the child sleeping? Can you show me? And do on-site education, which is invaluable. We also have some educational videos, and then we work very closely with Cribs for Kids. Other things that we did is those safe sleep sacks. If you ever have seen one, I think it was in a couple pictures ago, is the preferable way to wrap a baby instead of a loose blanket that can come undone. And so we were able to provide some for the community. Every November, we give about 1,000 to the community, along with the education about safe sleep and breastfeeding and many other important things that helps with keeping babies alive. So what we saw after all these efforts and a couple years later is a tremendous decline in our infant deaths that are completely preventable due to unsafe sleep. For comparison, the Child Fatality Review team from Dallas provided us their numbers, and that's what you see in yellow. And even though they have seen a decline, the decline seems to be lagging a little bit, but they're working on some similar initiatives, and we're able to start seeing, hopefully, a decline for them. So when that happened, and we were able to present to our newly formed RAC that comprises 22 counties, the idea became, whoa, this is kind of interesting. So Bexar County has 85% of the hospitals safe sleep certified. Their deaths are coming down. It is time to expand it to the entire region, not just a county. And so, working with STRAC and with our RAC, we decided to take this as our first quality project. This just started in December, so we've only had a couple months working on this, but it is the first quality project that we want to take in the neonatal side to the entire 22 region county. So clearly the problem is a huge one. So an unexpected infant death is completely preventable and is the highest cause of death for accidental death for an infant. And we do know that since 2016, the AAP has recommended that we do education to the community and within the hospitals. And in our RAC, we have over 50,000 infants that are born annually. So we have a great opportunity for impact and for change. We have our aims, and our first one is, of course, finding where we're at, right? We only know about Bexar County. How are we doing in the other 21 counties? So we need to focus on getting the information. Our phase 2 is implementation, which, if some of you have been in the progress of getting hospitals safe sleep certified, is not an easy task. And then, of course, we haven't even started phase 3, which would be maintenance, is how to make things stick. So using our SMART goals, we decided to first, within just 45 days of taking this as our job and our new duty, we have to find out how we are doing in every single hospital within our community. Where are we with education? What resources we have within the hospital? What resources we have within the community? And then what the biggest barriers are, because for some hospital, it may be one barrier. For another hospital, it may be another, depending on what type of hospital they are, whether they're rural or within the city, whether they're private or not. So we need to have some information of where we're standing. And so we send that it's done simply by a survey. And everybody, trust me, everybody had to answer, because if some of you who are sitting in that meeting, your name came up if you had an answer on the next meeting. So once again, competitiveness works. Just have people fighting with each other to be the best. So the baseline data, what have we found out? Well, we found out that the majority of the hospitals have some type of policy or program for safe sleep, but some of them, I think it was about 10% or so, 11%, do not have anything at all. And so that was a little concerning because you remember the AAP put out stuff a long time ago. But despite that, the education was in place. Whether it was formal or informal, the education was happening with the newborns at the very least. Ideally, we want to make sure the education happens in every single floor, including the ER. So where are we with hospital certification? There was a few people, there's a few hospitals who are in the process. About half of the ones that are not in process have certification and half don't. And the majority, except for a couple, were within Bexar County because we had been pushing so hard for a couple of years, so we needed quite a bit of work to do. And then the distribution of hospital certification, we only had one gold. Once again, we'll talk about the levels in a second, and that was, of course, SAMC. We had several silver and a few bronzes, and then the rest, of course, half of them don't have certification yet. So what is it? What is the difference between the three? It's, of course, it's a level of investment in your hospital in trying to make sure that we do the education. All of the levels, you have to have a policy in place on what to do with the patient in-house and what to do with the patient as you're modeling. And then, of course, training the staff is a part of all the levels. And then the last one for bronze is to do the complete education along with documentation that the education has been given to the parents. For silver, it is no longer using the loose blankets, the receiving blankets, to take care of the baby. Not necessarily in the delivery room, because that gets kind of messy. You still use the same stuff and immediately after. But as soon as the child goes into a crib, instead of using the loose blankets, using the sleep sacks. Whether in some hospitals have chose to do it one way and other hospitals haven't, you can have the sleep sacks only to be used during the hospital and have a laundering system, which is quite complicated in some hospitals, or give one sleeper for every single child, use it one in the hospital, and send that child home with it. And then, of course, the gold certification is the one where you expand outside your four walls, where you go into the community and educate people about what safe sleep is, get into the media, be able to spread education at every single fair and avenue that you can get your hands on. So we asked them, what barriers does exist? Now, knowing and explaining what they mean, what is it that is keeping you from having the certification? And not surprisingly, the majority of the people have a problem with the sacks, right? The sack cost and the sack laundering, because it's a problem in a lot of systems to be able to launder things without losing. I can tell you in Bexar County it's a major issue because I believe 3 or 4 of the hospital systems use the same laundering service. So how are they gonna keep those sacks separate? Because everything goes into one pile, gets washed, and it gets redistributed. So that has been a problem, except for the hospitals who use their own separate laundering service. And then, of course, the cost. Everybody is concerned about the cost of the sacks. Well, we are moving. We have all the information we wanted within the 45 days. Now we are within that 6-month period where we're trying to have our safe sleep certification. And so we have 2 aims in that project. One is to make sure that we have implementation of the safe sleep policies within the hospital, just the policies. 90% of all the hospitals within the region within 6 months. That finishes in June. And then to achieve more than 90% designation of safe sleep environment by the end of this calendar year. So we had to try to make it easier for everybody. Otherwise, it's very challenging to do when you have limited resources. So we created this chart. This is the chart that gets presented every time we meet, which can be embarrassing because everybody wants to be green at all times. But basically, we have 2 projects going. We have the period purple crying, which is another talk entirely. And of course, the first one is safe sleep certification. And in there, you can see that there's a lot of green. So a lot of people have policies in place. Now they're working on actually getting their certification. And then the last number, which you see still in the blue columns, blue title columns, is where they're at on their certification level. So we work with the different companies, with both Halo provides the sleep sacks and with Cribs for Kids to create an easy, it's just a 1-page handout that everybody has where they can have a 1-person contact for each of those programs that is helping them through the process of getting the sleep sacks and getting certified. But to take it one step further, we gave people a quick wins for bronze. We basically have done the job. We have a template policy that they just have to change the name and modify to their needs, that they can provide and get it approved through their system so that the hospital can start using the policy and you can apply for bronze. For silver and for gold, you have to have audits to be in silver. And so one way to do it is to do the audits and then have our RAC or STRAC be able to provide those audits to this CRIFs for kids for you, and then work with you and getting that take-home versus in-hospital sleep SAC program, working and getting going in your hospital. And then, of course, the last one, which STRACs will help them with too, is to do that community. You have to have hospital representatives to join our efforts within STRAC to provide education to the community, so that takes care of the gold if your hospital chooses to do so. So basically, what we're trying to impact change is to educate people on what is a safe sleeping environment. We do know that from studies, the child is more likely to survive if he's in your same room. So we want them sharing a room. We just don't want them sharing a bed. And so there is ways to facilitate that breastfeeding and that bonding and that time if we have some type of safe and protected environment within the parent's room, which is what we strongly encourage. And so what to do is simply talk to every single family at every single encounter, no matter where you're at, about how is the child sleeping, and not just how, but where, what condition is the environment in, who's sleeping with the child, do you ever put the child to sleep in a car seat? And we have to explain to them why the babies can strangulate in a car seat due to the different inclines when you put it on a flat surface as opposed to in the car. To talk about how this is a crisis and we need to update it and we need to fight it, and it's completely preventable. One thing that is very interesting is if you look at the map, and I'm sorry I didn't put it in here because I just found it yesterday. If you look at the map of how many hospitals in the state of Texas are Safe Sleep certified, you have Bexar County and the surrounding region, including Kerrville, and then there's only 4 hospitals outside of that area. So when you look at the United States map, you can see that the entire Northeast and California area are basically almost the entire state Safe Sleep certified. So clearly it's something that could be a quick win if we get all together and make it happen, and can show some significant decline on the infant death that is completely preventable. Resources, there's so much out there. There is just so much out there. Most of them are free. Actually, all of them are free. I mean, we had a lady up here from Room to Breathe, where you can just scan it and they can send you the little cards about safe sleep. Of course, you have the Back to Sleep campaign that will send you tons of information. All you have to do is register. You don't even have to be a facility. They get sent to my house so that I can go ahead and distribute from there. So there's a lot of written education that you don't have to recreate. And we have about 7 minutes. Yes, ma'am. Yes.
What do you know about the baby box program? Does that kind of dwindle away?
So as you know, in Bexar County, actually, we did partner up with the Baby Box Company and Baby Box University. That's how we were able to get those magnificent videos where they talk anything from breastfeeding to car seat safety and pool safety. We did try to get it off the ground. It was not very easy because once their funding kind of dwindled and the AAP wouldn't back it up, it just kind of fizzled through.
Okay. So as part of the certification process, I think in the application for a safe sleep certification, it asks if a family says to you, we don't have a safe sleep environment for our child, the hospital is to provide them with a safe sleep environment.
To provide them with resources.
With resources.
Yes,
Okay.
and there's a lot of resources in most communities that can help them with, one of them actually is the Southwest Research for SIDS research. There is a program, and there's many other programs, where the families can fill out the application online and then they go to Walmart and pick it up. So there's quite a bit of resources out there.
Okay, thank you very much.
Yes, sir.
I have two questions. One real quick, do your OBs tell their moms to go advocate their baby showers for these kind of items? And two, do you make rounds on your pediatric floor at night and see how they treat their children?
We do on the hospitals that have achieved silver or better. They have policies in all the floors, including the ER. And actually, in the majority of the floors, children's floors, they have parents get a handout and sign the day because we don't want to find them sleeping with the child. Now, do we do rounds? In order to maintain silver or gold, there has to be self-assessed audits. So they have to document so many audits done within that year that they are keeping up with the maintenance. And as far as the OBs, well, we have a lot of work to do with the OBs, yes. From encouraging breastfeeding to making sure that everybody has a safe place to sleep. So we're working with them and we're getting community involvement. Yes. Oh, gosh. Go ahead.
You discussed one of the barriers to implementation being cost of the safe sleep sacks, but then there was a slide where there was an ability to get free safe sleep sacks.
Yes, when you partner with them as a partner for Cribs for Kids, there is a program that you can use through them, but they're only for in-hospital use. So they provide you so many, depending on your birth rate or how many deliveries you have a year, they provide you a certain amount of sleep sacks that you need to launder yourself, but they need to not be given to the patient.
And in the absence of that program, what is the actual cost relative to receiving blankets?
I believe it's about $2. We buy them, do you remember, $5 a piece?
For a
or
sleep
so?
sack?
Yeah, yeah. Yes, it depends on volume and whether or not you want a logo embroider. We buy them through the nonprofit for about $5 a sack.
Wow, thank you.
Yeah. Yes, ma'am.
In light of the fact, I think it's like 40% of mothers, at least occasionally, share a bed. And I didn't know if you were familiar with the Academy of Breastfeeding Medicine's protocol from last fall, kind of taking a more nuanced approach to how to counsel families, acknowledging that there's a continuum of risk and that given such a large percentage of families do at least sometimes bed share, that perhaps counseling should be more nuanced.
Counseling should be absolutely more nuanced, and the counseling has to be different from a baby that is 2 months old to a baby that is 9 months old. And so for those families that are very well educated on how to safe sleep is a little different story than those families who are not. I did see some images from the academy where they talk about the C sleeping with the baby. I didn't like the way the images were done because once you never stay asleep in this position, in the fetal position, and the way the baby's head was. So there's a lot of education that has to be done, and people, because one of the biggest arguments is like in third world countries, they all co-sleep. Well, in third world countries, they don't use thick blankets, and they have continuous care. In Finland, for example, they have the 1 year maternity leave, and they have people who take care of the mothers and the children and continue that education throughout that year in the home. So there are much different risks because they have the education on how to do things. And as you know, our patients don't really have the resources or the access to care, much less to counseling.
Hi, I have a question about whether or not you did any education or any initiatives with the providers that see the baby, like at follow-up appointments. I know we have started speaking with our mothers at follow-up appointments about, great, you put this baby down to sleep at bedtime in this environment, but at 3 in the morning when the baby woke up and went to go back down, where did he end up? So did y'all do any of those initiatives?
We do. We have to. That's part of maintaining the gold certification, which SAMC is the only one that has it at this point. But part of what we're doing as a community, from the Child Fatality Review Team, from BEST, and all the communities that are involved, including the health department, is to make sure that any avenue that we have is educated to the family medicine, to the nurse practitioners, to the pediatricians on those follow-up appointments that are so important. We talk about this in the San Antonio Pediatric Society at least once a year to re-educate, bring back the statistics, bring it to the forefront and center. That's the only way. We're very active in every single community fair there is in making sure that we have a presence. And that's where BEST and the money funneling through it came, because we have been able to take that stance in addition to the health department, which, where's my health department rep right here? There she is. They are fantastic, the Metro Health, and helping us recognize those opportunities for education and to help us be a presence in everything. Yeah. Yes. Cribs for Kids. They have an active, yes, and it's located in the Northeast, and that may be why the
Right.
Northeast is heavily
Okay.
certified.
I'm familiar with them.
Yeah.
I also wanted to ask, what are the 4 hospitals outside of your area?
That's an excellent question. There is one in Dallas, there is one in Houston. I didn't actually see which ones. There is 2 in Waco area. So Baylor and,
There are only 2 hospitals in Waco.
yeah. Yes, yes, so we can move to the next place. Well, thank you very much. In the slides, there's both of my emails, so you can contact me and reach me that way. Thank you.
So just want to let everyone know, there's a 5-minute, there's a little schedule says next session's going to start right now. There's actually 5 minutes to get to your next. So move quickly. It's like being in high school again.
Yes, the bell is going to ring.